It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is mail order prescription drugs. Joining me is Joe Pons, who is the owner of Canadian Meds of Melbourne. Welcome, Joe.
Thank you, Joe.
It's a pleasure to have you on the show, Joe. Not only because you're an interesting guy to talk to, because I learn a heck of a lot when I do talk to you. And the most surprising part about all of it is that it is hard for me to believe what you tell me, because there are so many people that could be helped that simply don't know about Canadian Meds, what you do, or other companies like you. I think that the business you're in is probably one of the most misunderstood. And has anybody ever told you that before?
Yes. But I work hard at letting people know.
How about telling our viewing audience exactly what Canadian Meds does and how you do it and why it's good for people to know about it? Because I think it's extremely important. Then we're going to talk about some of the changes and some other interesting things and some questions I have for you.
Absolutely. Okay? Absolutely. Canadian Meds of Melbourne does one thing, and it does it very well. We save people money on their prescription medications. How we do it is very simple. The name Canadian Meds comes from the fact that our pharmacists are in Canada. That allows us to purchase the medications from the manufacturers wherever they're made on the planet. That cuts out all the middlemen, cuts out all the waste, cuts out all the greed. It allows us to basically take the medicine from where it's made, have it sent to our American citizens wherever they live in the United States, and have them save anywhere between 60 to 90%. They get to enjoy the savings. And it is as simple as that.
You know, Joe, I'm going to shift. I'm going to look right at my audience. I'm going to tell you, audience, what Joe has explained to me today, I'm going to ask him to explain to you, because I still find it hard to believe. He is telling me that he can buy the medications from the manufacturer outside the United States, ship those medicines to American citizens. He can still make a profit for himself. You save people money, and it cuts out all this other stuff that these big drug companies are charging people for. And it's come home to me, Joe, after you talked to me about it. I went back and I'm retired military. And my medicine costs are $9,834 a year. Luckily, thankful for me, they're paid for because I'm a retired military. So I don't have to worry about it. I'm very fortunate. There are people that had to have those same medications. And you tell me how an 89-year-old woman living on Social Security of $800 a month and food stamps is going to get those medicines, because her 800 times 12 is, my mathematics, are 9,600. If she had the same medications I have, she'd either live on medicines someplace without paying rent or anything else, and it's impossible. What do you think about all this? Knowing what you know, and your business has increased over it since the first time you and I talked.
Absolutely. Two things. One, unfortunately, that young lady, if she's taking her medicine, she is surviving on either samples from her doctor, which unfortunately, over the past year and a half, have dwindled down to almost nothing. Fortunately, for a lot of my clients, Quite a few are still getting those samples, so they're able to at least take some of their medications. More often than not, that young lady is not going to take her medication. The choice comes down to eat or take medicine, have a roof over her head or take medicine. You and I both were blessed. The VA is going to take care of us. Our medicine is paid for. But you're right, the math doesn't equate. So there's got to be an alternative. That's what our service is about.
Tell our viewing audience how you do it, how they get involved, and some of the advantages and how easy or difficult it is to do. I have no idea, Joe.
Okay. A phone call is what it takes. However many medications that you have, all I need is the name of the medication, the dosage or strength, and the number of times a day that you take it. That's it. What I do is I look it up and I give you the pricing, ideally for 90 days, because that's usually the sweet spot. 30 days, we can do. 60 days, we can do that as well. But in the large volume store philosophy, the more you buy, the more you save. So the 90 days is usually the best buy, the more efficient or cost effective measurement, if you would. It takes all about 15 minutes to fill out our form, basic medical information. That way, our pharmacists know exactly what you're taking, whether you get it from us or not, to ensure your safety. After we fill out that form and figure out if it's a good fit for you, because the fact is that if you're already saving money, great. Okay? There's no need in you in changing from what you have if you're already saving money. But if it's a good fit, then we get to move forward. 5 minutes later, we place the order. Within 3 weeks, your medicine arrives at your door. After that, as long as we have your prescription in hand, we can make it with a phone call. We can place that reorder. It is done. It's that simple.
How they pay you by credit card?
By credit card, personal check, or cashier's check. It's that easy, Joe.
I know it's hard to say how much you can save money, but you've estimated you can save help people save between 60 and 90%.
That's correct.
That is darn hard to believe. It really is. And most people hearing us talk about it says two guys are nuts talking about saving that much money over drugs. But it's true.
Yes, it's absolutely true.
I thought it was extremely. What bothered me a lot, Joe, it bothers me, and I understand. I've been around medicine for a long time. Yes, prescription drug companies have to make money. I understand that.
Yes.
They turn some of the money back into research. I understand that too.
Mm-hmm.
But still, the profit is tremendous, and it's been admitted to in testimony before Congress. The profits are enormous. They're outrageous.
Yes.
You can buy these medicines, save people all this money, and they're still making a profit on what they're selling you.
Yes. Absolutely.
But the number one drug that Americans use, a drug called insulin, is something you can't get. Is insulin made all over the world?
Yes. Yes.
So why can't you buy insulin then?
We have been boxed out, if you would. It is no longer in our supply chain. We only deal with certain companies, and we deal with a significant group of companies globally. But we only deal with certain companies that have their doors open. That means they're either FDA approved or approved on the World Health Organizational level to where their doors are open. We can test their safety. Their records are open. We don't deal with anyone else. When we cannot get a hold of insulin that is known, trusted, and used here in the United States, we won't sell it.
Okay.
And when we are no longer able to get that brand, those brands, we can no longer offer that significant savings for our clients, and that it bothers me significantly. It bothers.
Well,
me.
let's just talk about it for a minute. You explained to me before the show that years ago you were getting you could get this in terms of instant stuff. And then a couple of years later, it shrunk a little bit. Then it shrunk some more, and now you can't get anything. And what's important to me is that you told me that the average cost of you tell the audience, how much insulin does the average person use?
Most of the people that have been calling me use about a vial a month.
And a vial costs roughly?
In the neighborhood of about $300, $350 a vial.
So we're talking about $300 a month for just the insulin.
Just the insulin. And
so if a person, an 80-year-old person in the United States is living on Social Security alone, well, does Medicare cover insulin? It does, doesn't it?
Yes, that is one of the things that is covered, at least partially, depending on plans. And of course, if they have outside coverage, then it's also covered to a degree. But because we don't deal with a lot of these plans, I don't know how much is covered.
Okay, so what group of people are we? We're basically talking people under the age of 65 that are diabetics and need insulin, that you can't help them.
No.
But the people 65 and older are covered by the government.
Yeah, and it's growing every day. And I feel that, and this is my opinion, and take it for what it's worth, and I think that is probably part of the reason why we have been slowly being pushed out of the way, is that as diabetes is becoming more and more epidemic, and of course they're being able to sell more insulin, we can't pass on that savings now.
Well, it bothers me too, because I just finished doing 2 shows with eye doctors. One is a retina specialist, and another was, if you want to call it an ophthalmologist, is an eye surgeon, cataracts and retina repair. Both of them talked about the effect of diabetes with macular degeneration, and then with cataracts and glaucoma, and you know, we have to do. What do you think that? Do you think the Affordable Care Act is caused part of that, or do you see? How do you see, Joe, as a private businessman dealing in medications? And I want to make it clear to the viewing audience that all your drugs that you ship are checked by a pharmacist.
Correct. Absolutely.
You're not a pharmacist, but all the drugs. That's why you have the sheet, so that they know what the doctor has prescribed. How do you know when you send that sheet to where your orders are filled that person is taking that drug? How do you know that? Is there a way we can tell that does their primary care doctor get involved or not?
As far as their primary care doctor is involved, it's the individual. And that's the important part, is that we get with the individual to make sure that they give us the listing of their medication.
Okay.
Because there's no centralized system for doctors to cover their patients, we use the individual, because a patient can see more than one doctor.
Right.
And because now we're dealing with the Affordable Health Care Act, we have patients who have a doctor that they've seen for 20 years and then see a new doctor. Right. So they may have prescriptions under 2 different doctors. The doctors may not know about the other's existence.
I know.
So they're prescribing medications for the same client, this patient's receiving possibly 2 interactive drugs. The patient doesn't know. Our
But your pharmacist
pharmacists
know.
will know. Exactly.
Yeah. Okay.
And that's where it's so important for us to get that information. And we rely on that. And more than once, it's come to light that drug interactions have been occurring.
Okay. And another thing is some of the drugs that you can't get are prescribed or what do you call them? Like Lortab or Oxycontin.
Right.
You cannot get those kind of drugs.
Correct. We can't get any kind of painkillers, controlled substances of any
controlled substance.
Correct. We can't get any controlled substances. As I like to tell people, I can't get you high, but I can get you by.
That's what it said. But you get down to a drug like Lyrica, which is a drug that's used for treating of fibromyalgia, and Lyrica can cost up to $1,000 a month, or $1,200 a month, and the average person cannot afford that. You're talking $12,000 a year just for a drug supply, and for one thing.
For one thing.
One thing.
Yes.
It's and then I just read recently where they're going to try to force doctors to write the prescription so that a person can only get controlled substances from one pharmacy. They couldn't get things from 2 different pharmacies, and they're putting. I've watched. I take a pain medication, and I'm very aware of the rules and regulations, and I take the exact prescribed dosage my doctor tells me. I could take those pills and crush them and get a far greater effect, which is what hopheads do. They do that kind of thing.
Right.
I don't do that, but I know what can be done. So I know how important it is for all of us to take these kind of controlled substance medications to do things the right way. But I also know it's important for people that are hurt, that are in pain, to be able to have access to medications. And it bothers me greatly that there isn't a way for companies like yours to get the controlled substances used somehow legally. Has there ever been any thought given to that?
I believe, and there are ways of doing that. The difficulty is that because of the regulations and the bureaucratic red tape that is involved, it causes such it becomes so time intensive that it makes it very, very difficult.
Okay, yeah, because
to help people.
When you need the drugs, you need them now. You can't wait.
Exactly.
Yeah,
and that's part of the reason why, as a company, I've decided that it really is more detrimental than a help.
You do enough good getting people the drugs they need to keep them alive.
Correct.
And that's important. What are some of the changes since the last time you and I talked about? I noticed that one of the things we were talking about new deductibles and big savings in deductibles. What's happened there?
There's been a new deductible this past year. Some prescription drug coverages have added a deductible at the beginning of the year. In addition to changes within just regular health plans, certain medications have had a deductible placed at the beginning of the year. The problem with that is that is to the tune of $100 to $500 in January, February, March, which means before a person sees any kind of coverage from their health care company, they have to come up with this large amount of money.
Wow.
And they're still paying their premium. If they're in any way using their plan, they still have to come up with their co-pays. They still have to come up with their deductibles. So here's a person who last year may have been paying $20 or $30 for this particular medication before they get to see that discount. Now they have to pay $500
before they can
before they can get their medication.
And that's one of the things under the Affordable Health Care Act.
I don't know if it's because of the Affordable Health Care Act. I would imagine that it is, but I know that there's something that we have seen come up more than once this year. I'm getting more and more folks up in arms because this is not. I don't know if there's such thing as a non-necessary medication, but this is medication that people need, and they need it right now, and they can't go without it. And when you take someone who, has a fixed income, and I suppose to a certain degree, all of us who are working have a fixed income, right? When you give us a bill of $500 and say, guess what? You either come up with it or you don't take your medicine. Well, guess what? Now we have a problem.
Well, I recently talked to a gentleman that he had severe periodontal disease. His wife had been in a hospital, contracted MRSA in the hospital.
Oh, my goodness.
Had an operation, came home, had to go back, have another operation. She now has had this protrusion on her stomach. They did a sonogram, I think it was, and she needs to see another doctor. And I know the man's, he pays $400 a month out of his salary for their health care plan, their coverage. And that may not sound like a lot, but $400 out of some people's income is a lot of money. And that's $5,000 a year for medical coverage. And he told me that it's not even beginning to cover, doesn't even start to cover the bills he's getting. So, we've boxed ourselves in, and companies like Canadian Meds offer us a way to reduce a cost that we must bear, and you're doing things to help people. What does our viewing audience need to know that I haven't, so far in our discussion today, triggered something? What else can you think of that they really need to know? Anything that's happened in the last year we're talking?
Anything that I think we pretty much just discussed most of it. I think for the average everyday individual who's kind of riding that fence, I would suggest that start with one medication, because all it takes is a phone call. Get your medications together, get a list together, and call. Because all it takes is that one medication, that little bit of savings, just that one, is what most people need to get by. It's that quality of life, Joe. That's what we're talking about.
Yeah. And there is, we have such a problem now with so many, roughly 10,000 boomers a day entering on Social Security. But when you're talking 50 years of age to 65 years of age, you got a 15-year period in there where these people, they're not covered by Social Security, Medicare, so they have to bear the cost of all these drugs. And as you get older, you have more illnesses, more things you need drugs for, and most people don't have the medical type coverage to cover medicines until they're 65.
Right.
I'm not aware of any. Are you?
No, not off the top of my head. And that is the area that most people don't think about as far as health coverage is concerned. When they think about health care, they think about hospital care.
or nursing home
nursing
care.
home
I'm going to
care.
pay for assisted living or daycare.
Exactly.
They're not thinking about the active care they have to take care of themselves when a doctor prescribes medication.
Correct.
You could have an infection, and you might have to. Well, what if you had to have I did a 7-week infusion period. I can't imagine what that would have cost me if I would have not been on Social Security, to go to a doctor and every day and have a thing placed in my arm where I had that portal in there where they could put that medicine in me for 7 weeks. And this happens more than most people think about.
Yes.
Do you get involved in those kind of medications too?
We do have injectable medicines. One of the latest medicines that I've been helping people out are for those who don't have cartilage. So orthopedic surgeons who require their patients to purchase injectable, not to get too technical, but hyaluronic acid to inject into their joints.
Okay.
These syringes full of this medicine cost over $1,000. With us, it costs $200.
And this is a syringe that's used for injection of medicine after surgery?
Actually, this is what the doctor uses to perform this particular outpatient surgery. So, and it is absolutely wonderful when you have a person who has put off surgery because they can't afford the medication, call and say, you know what, because of you, when this medicine arrives, I will be able to have this needed surgery.
That's amazing. We're out of time. I wish we had more time, but we'll do it again on another TV show. But I want to thank you for watching us today, folks. And I hope you learned something about Canadian meds and how you can help yourself by making a phone call. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.